Hey, Dr. Kwon here again, and this is part 5 of a video series on decision-making in advanced prostate cancer. And here's Fred.
Hello,
Fred,
everyone.
what are we going to talk about today, this video?
Today, we're going to talk about option 2 in terms of my treatment, which is to start hormone therapy at a later date, which is currently right now. So I'm actually taking it now. So, and that was caused, I finally decided to do this because my PSA rate had been climbing pretty steadily. And it went from, way 0.01 to 4. So in the course of the last couple of years. So based on that and conversations with the doctors and guys in the support group, I just realized that now was the time to do it.
Yeah, and so even backing up, having an option 2 here is a little bit of a unique situation, because typically when we have a decision to be made about treatment and their options, we think of like a certain type of treatment and then a completely different type of treatment and picking between one or the other. But here we're talking about options being starting a treatment now versus starting later, which for you has become something you started very recently. But I still think this is a good way to frame questions about decisions, that there often is more than one option. Like even in terms of doing a certain test, like genetic testing, that might seem like there's just one option, but technically there are 2. You could do the test and you don't have to do the test. So for you, Fred, in this situation, it was waiting. I'm sorry, not waiting, but doing it immediately. And just thinking about, back then, option 2, and putting yourself in those shoes, that, you might have mentioned this already in the last video, but what was the risk or what was the benefit of doing it immediately as presented to you by your oncologist?
Well, unfortunately, that's the point. I mean, it was never presented to me that way. It was a decision I kind of had to figure it out myself. And that's really the answer. I really wasn't told. It was just like, well, we should start it now. And I'm like, and it's just, to me, it sounded just like a standard protocol. That's how they do it there, and that's kind of got what I got. But it upset me enough to get a second opinion. And that's kind of changed things. That's when my doctors realized that maybe it was time to start it, because he didn't object to not starting. But he didn't really explain why I should start it right now, other than obvious reasons. But yeah.
Yeah, and sort of the risks and benefits of starting now or in the past would have been or sort of the inverse of the risks and benefits of starting later. And so if we put ourselves in the shoes of back then and starting at a very low PSA, starting your treatment back then, the risk would have been that we're over-treating you, like we're starting too early. We're giving you all these side effects that we don't really need to give you, and we could have potentially saved you some time on having these side effects if we started later. And then the theoretical benefit at starting immediately at that time could have been better cancer control immediately. And again, sometimes that's not needed, like we're talking about.
Right.
You don't need necessarily all the time to start treatment to control the cancer right now if we think we can do just as good a job at a later time. And there's no real hard line, and that's why it's often good to bounce it off other people and get a second opinion. Some people even get a third opinion to really see what different oncologists think. They also have different levels of expertise and training and perspectives, having seen different types of patients. So I'm really glad you got a second opinion there.
Yeah, no, he's been very helpful. I've talked to him several times.
Great, and we'll definitely touch on second opinions and other resources and tools to get these sorts of information when you're making any sort of tough decision at a later video.